So I went ahead and applied my PPE outside of the room. Upon entry, I'm going to go ahead and sanitize my hands, either foam and or wash, apply my gloves. So knock knock. I'm going to open the screen and close it for patient privacy. Upon entry, I've noticed that there's no issues with attachment to any lines. The patient seems to be, their airway, circulation, breathing seem to be good. The patient looks to be in good health and doesn't have any obstructions, and doesn't look like the patient is in any pain. So I'm going to start by assessing patient's name and date of birth. Do you mind verifying your name and date of birth for me? Mickey Mouse, 9699. Do you have any allergies? No? Okay, perfect. So today I'm going to be performing a physical assessment on you. If you have any questions at any point, you can go ahead and just let me know. I'm going to go ahead and raise your bed up to a working position and lower your rail. We're going to start today. It looks like I have your vitals right here. It looks like that we just took them. Your blood oxygen levels look to be good. It looks like it's resting at about 96. Temperature is good, about 98.7. Blood pressure is about 120/80, and your breaths are about 12 per minute, and pulse is about 78 beats per minute. So it looks like everything is good there. So we're going to start from head to toe. So I'm going to look at your ears first. Have you had any trouble hearing lately? No? Do you wear any hearing aids? Okay, no. So upon assessment, I'm not noticing any breakdown inside of the ears, no blockages, no discharge. I'm going to move down to your eyes now. If you don't mind taking a look over at my nose while I do a sweeping motion under your eyes. Pupils are round, equal, and reactive to light and accommodation. If you don't mind looking at the pen. Okay, perfect. And so I'm going to check inside the nose now. Doesn't look like there's any breakdown inside the nose or bleeding. No trouble smelling? Okay, good. If you can say ah for me. I look inside the patient's mouth for any signs of dehydration, ulcers, or any breakdown inside the gums, teeth, tongue, uvula, or tonsils. Doesn't look like there's any issues there. I'm going to go ahead down to the patient's. I'm going to move down now to your chest. So we're going to listen to your heart today. It doesn't look like the patient has any breakdown on the chest before listening. So I'm assessing for your aortic sounds. This is an S2 sound, and it is in the right of your sternum in the second intercostal space. Your next S2 sound is going to be your pulmonic. This is in the second intercostal space as well, but to the left of the sternum. Then we move to the bottom right area. This is going to be your tricuspid sound. This is an S1 sound, and it is in the fourth intercostal space, about the mid-sternal line. And then we're going to go down to the bottom left, and that is your apical pulse, or apical sound. This is an S1 sound, and it is in the fifth intercostal space. And it seems to have good rhythm, rate, everything like that, good sound. Now I'm going to assess patient's breathing. Breathing looks okay, but we're going to listen. No breakdown on the skin before listening. I'm going to check up at the top by the trachea. This is the bronchi sounds. The bronchovesicular are about mid-sternal sounds. And then to the bottom areas of the lung, I'm going to go ahead and listen to the patient's vesicular sounds, which are very normal sounds. Everything looks normal. And I'm going to go ahead and flip the patient forward. I'm going to check for abrasions or any issues there. I don't see any abrasions or bed ulcers or sores. I'm going to listen again. I don't hear any wheezing, crackling, or rhonchi, which is great. Okay, perfect. I'm going to lay you back again. And before I go back down, I'm going to go ahead and check your capillary refills on your fingertips. Looks like they refill within 3 seconds. And then I'm checking for jugular vein distension, laying you at a 45-degree angle. Everything looks to be good there. And then, do you have any calf tenderness? No? I'm going to palpate your calves, make sure everything's okay. Looks to be all right. That's perfect. Okay, so we're going to move down to your stomach now. Do you have any trouble going to the bathroom? No? Did you have any nausea, vomiting, or diarrhea today? No? Did did you have normal stool movements or bowel movements? Okay, perfect. And then I did notice that there was amber colored pee or light yellow pee in the urinal. Did you have any pain when you went to the bathroom? No? Okay. And patient didn't have any trouble ambulating or getting up to go to the bathroom, right? Okay. Oh, and then I would have, when I was assessing the patient's head, checked for alert, oriented, verified with the patient, their name, the time of day, their person, place, and what's going on. Patient is alert and oriented, there's no issues there. So I'm going to go ahead and assess the patient's stomach. And before assessing, I noticed that there's no bumps or abrasions on the tummy. I'm going to start in the right upper quadrant, then the left upper quadrant, down to the right lower quadrant, and then the left lower quadrant. The only sounds I'm hearing are like gurgling, which are normal bowel movement sounds. And I'm going to go ahead and palpate, so you just let me know if you feel any pain. I'm assessing for further bumps or any kind of movement. No issues there. So we're going to go ahead and go down and check on any numbness or issues with perithonesis. Doesn't look like patient has any issues there. I'm going to have you push up against my hands on both sides. Perfect. Patient had symmetry and was able to perform wrong exercises just fine. So I'm going to assess patient's skin breakdown or anything like that on the lower extremities or any extremities while I'm here. Doesn't look like there's any issues there. I'm going to go ahead and now check their pulses. So we start with the temporal pulses on the side of the head. Then we're checking carotid, and we're doing everything bilaterally so we can check for symmetry. Then I'm going to do the patient's brachial, ulnar, and radial pulses. So the radial and ulnar, brachial. And then I'm going to check the patient's apical pulse. Everything looks to be good. The next one would be the femoral pulses, down where the leg meets the pubic area. And then the popliteal pulses behind the knee. The posterior tibial pulse. And then the dorsal pedal pulse. I already checked patient's pulse in brachial, ulnar, and radial areas. Oh, and I'm going to also check for patient skin tinting. So I'm going to pinch on the patient's skin, a light pinch, make sure that there's no tinting so the patient is hydrated, no issues there. And then make sure that there's no, issues with the IV. So like where the IV enters the patient, there's no reactions with the veins and like any kind of bandaging or anything like that. So it looks like overall the patient's in good health. So I'm all done with you today, Mickey Mouse. Do you have any questions for me before I head out? No? Do you have any pain? No? Do you need to go to the bathroom? No? Do you need any possessions? No? And your position is just fine? Yes. Okay. So, and then you had a good gait and you were able to ambulate by yourself to the bathroom earlier. Do you think you'll be okay again? Yes. So I'm going to go ahead and raise the bed rail and lower the patient back down to the resting position. Here's your call light. You can go ahead and call us if you need us at any point today. And I'm going to go ahead and close the patient's curtain, go ahead and foam out and remove my gloves and dispose of them and head out.